Welcome back to Newsbreak. This morning we are discussing mental health, and I have in the studio here Humphrey Kofie, Executive Secretary of MESOC and Country Facilitator of the Mental Health Leadership Advocacy Group. Thanks for your time.
Thank you so
Now,
much.
I have a long press release from your outfit here. What are your concerns?
Well, thanks so much. You recall that last year, 2012, the Mental Health Act was passed by Parliament on the 2nd of March. Subsequent to that, the late president assented on the law, on the bill to become a law. That was on 19th of May 2012. Now, 6 months down the lane after it's been assented, it's assumed to be in full force. Since then, nothing has happened. There is so much laxity on the part of government to see the full implementation of the law. Now, we thought that the passage of the law meant that there was going to, the mental health sector was going to be revamped. So it was an excitement to stakeholders and actors in mental health. But if up till now nothing is being done, then we have a problem. Now the mental health law, the mental health authority under section 2 of the law requires the establishment of the authority as it is. Pursuant to the act, the law also confers our government to establish a mental health board. Now, without the board, nothing can happen. The structures cannot be put in place. Nothing can change in terms of mental health in Ghana. And our act, that is Act 846, has been described by the World Health Organization as the state of art law, which is even being copied by other countries. So we don't really see why government is so lackadaisic at seeing the full implementation of the law. Now, if you go to the mental health facilities, there are several abuses, violations of rights. People are put really in secluded areas within the prayer camps, within the faith-based organizations, within the traditional healers camps, and even the psychiatric hospitals. Now, it is so irritating to see a law that can see a quick reform to the entire sector of mental health, sitting down there, and nobody seems to care as to ensuring the full implementation of the law. So that is our problem. And we think that government has taken a bold step in ensuring that it is passed, it is accented. But the main issue related to the law is to see to the full implementation of it. And if it doesn't start now, we're wondering what time it is going to start.
But you are blaming transition of government machinery for the delay. Don't you think that perhaps it's just a matter of time? Because we just see Cabinet approve the Freedom of Information Bill. Don't you think it's just a matter of time to see it come to pass?
No, at all, because the law is explicit on which people should be on the board. There's somebody supposed to be from the Ministry of Interior, Attorney General, Ghana Health Service. It's clear, and 3 people from other 3 non-governmental organizations. It's clear who should be on the board. Now, I don't really know whether it's the chairmanship which is the issue, or is the aspect of the law which talks about the establishment of the mental health fund, which government has a problem with. In any case, the law was passed last year. In the 2012-13 budget, we knew that there is supposed to be a mental health fund. Nobody needs to tell the Ministry of Finance that this should be incorporated. In any case, if the Ministry of Finance doesn't, then we should blame the Ministry of Health, because the law comes under the Ministry of Health. So if that is a problem, they should let us know.
But will this mental health board change anything anyway? Because you have boards at the various institutions. Will it change anything anyway?
Well, I can understand where you're coming from, but you see, we need to take it a step at a time. We know, as you're saying, that there are several boards, and that's why those who come on the board should have the passion for mental health, irrespective of the fact that they are supposed to come from various ministries. They should have the passion for mental health. And that is how come we can move forward. Because if the president is very much interested in ensuring that the law works, there are several things. Look, the structures that has to establish the law and see the full implementation of the law are supposed to be established by the mental health board. We know that some aspects of the law can be